Hi, I'm Dr. Mike, and I'm taking over this week's episode of the Wellness Lab on knee pain. Hi, I'm Dr. Mike, and with me today is my lovely assistant Ashley, and what we're going to be going through today and talking about is knee injuries and a simple knee assessment. When a patient comes in the office with a complaint of knee pain, the first thing we're going to do is just simply sit down and talk about what the problem is, where it is, how it occurred, whether it was due to an injury or a long-term chronic type issue, get any contraindications that may go along with it, surgery, replacements, all those sort of things. But when it comes to knee issues in general, there's a couple tests that we always start off with just to kind of rule out any major problems or things that may contraindicate us from doing care. So lay face down for me on the table, please. So we're going to do a couple tests just to check out kind of the integrity of the meniscus as well as the medial lateral collateral ligament. So I'm going to bring your leg up, just going to apply some pressure down onto her foot, ask her if there's any pain. If this elicits pain, it'll come up pretty quickly. Then do a little rotation, do the same thing, rotate the other direction, do the same thing. Once again, always asking her, is it painful as I do it? Do you have any pain with this? Second piece of this, we're going to do kind of the opposite. We're going to kind of distract the knee up and out. Same thing, asking if there's any pain with that. Looking at this one with the integrity of the medial lateral ligaments. Go ahead and flip it over your back for me. If all that comes back negative and we're showing that structurally the knee is good integrity, there's nothing torn, nothing torn in that facet, what we're going to do next is just kind of get a basic assessment of kind of the alignment of it, looking at the relationship of the tibia to the patella, looking to see are they lined up in that extended position, and then once again how they line up in the full flex position. Check to see the motion there. Give a little front to back pull just to see how it's moving. If it has too much motion, that can indicate some type of tear with like the ACL. If there's not enough motion, it means that it may be kind of offset of the tibia to the femur. Give kind of a forward to backward, side to side motion, just to once again check all the integrity. Check in motion of the fibula to see how that's moving. And based off of that, we can make our determination of what is going on in terms of the knee and then how we can then directly address what's going on with the knee itself. We're going to take a quick break and we'll be back with Rainey's Fitbit next.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about knee pain, so I want to go over 3 ways to foam roll out your knee pain. So most people don't realize that tight muscles and limited mobility can affect your joints, or what may seem like it's affecting your joints. So in the office here, we do a lot of foam rolling. So that's what I want to show you today is just different ways to hopefully help that knee pain. We can roll out the tense muscles in your legs. I actually do have a personal experience with this. I was a college athlete. I was having a lot of knee pain, so I ended up having knee surgery. I did have a slight tear in my meniscus, but even after surgery, I was still having knee pain. It was still bothering me a lot. And I found out that my hips were tight, my T-bands were super tight, which are right here down the side of my leg, and it was causing a lot of tension pulling here on the upper portion of my knee. The more that I've foam rolled, the more it's loosened up, and I don't have any knee pain anymore. I can run, I can work out, I can do whatever I want, and I have 0 knee pain anymore. So it's very helpful, but most people don't know about it. So this is what a foam roller looks like. You can find them in almost any sporting goods section in a store. There's different sizes and textures, and then there's different densities. So some of them can be very compact and hard, so it puts a lot more pressure on it. But then others can be kind of squishy on the outside, softer foam, so it doesn't hurt quite as bad. So you can kind of take your pick. I like to use the harder one because I feel like I'm putting more pressure on my muscle and it's gonna push through there and get the tension out a little faster. All right, so let's start here. The first way we're gonna do it is we're gonna lay it horizontally like this, and then you're just gonna kind of get down on your stomach. You're gonna start it about right below your hips. We're just gonna foam roll out the quads. So those are the big muscle right there in the front of your thighs. You're just gonna start right about there, and then you're gonna be on your elbows down, and then kind of army crawl your way forward like this. Just kind of rolling it up and then back, just like that. What you're gonna feel is if there's a knot or some really tense spot, it may hurt a little bit, so you can stop in that one spot, maybe, let it loosen up a little and then roll it out again, just like that. So that would just be for the quads. Then what you can do is if you have lateral knee pain, so knee pain more on the outside like I did, you're gonna roll out your IT bands, which are there on the outside of your leg. So you're gonna start up by your hip like this, and then you're gonna gently roll it down the side of your legs. You can go all the way down towards your knee. When you get to your knee, stop, go back up. Again, if you feel a spot that's very tender, kind of roll over it, really try to release it, and then just keep repeating. This one will be very sensitive. It may hurt a lot more on the side than it did on the front. All right, and then the last way is to roll out your adductors. So your adductors are here on the inside of your legs. So what we're gonna do this time is move the foam roller vertically like this, and you're gonna lay beside it on your stomach, and then you're gonna lift your knee up and onto the foam roller like this. So you can keep your knee bent. And then you're just gonna kind of move laterally like this so that it's moving up the inside into your groin area and then back down towards your knee like that. This one is also very sensitive, especially down by your knee. It may be a little more sensitive, but again, just up and back like so. Nice and slowly also. No, don't try to rush it. What I would recommend would be to use it for about 1 to 2 minutes a day. Obviously, the longer you do it, the better. Really try to work it out, really try to get the tension out for as long as you can. The better, the sooner it will feel better. And like I was saying, it's gonna hurt. So if you need to take breaks between, if it gets too painful, that's perfectly fine too. Just keep pushing through the pain, try to get those muscles to relax a little more. But yeah, so that's been this week's Fitbit, and we'll see you next time.
Welcome back. What we're going to go over now is we're going to go over the range of treatment methods that we have for dealing with knee pain. In the previous portion, we talked about our assessment and what we look at, what we're looking for when we're dealing with knee issues. The range of things that we have available is based on each individual's treatment needs. So based off of our assessment and our history and kind of what your goals are going forward, we'll employ one or many of these different methods to help deal with your problems. The first one, and first and foremost, is the adjustment. So whether it's adjusting the knee, the hip, the ankle, the lower back, they can all be connected to knee type issues. So doing a manual adjustment, working with those joints themselves, that's kind of our first and foremost method of dealing with knee issues. Next one we're talking about is going to be the foam roller. So Rainey talked a little bit about foam rolling exercise and things that you can be doing. This is a really good one that we employ with a lot of our patients because it's basically self-maintenance. It's something that you can do on your own in between treatments to help to kind of ease your process or progress through care. Next one that we're going to look at is going to be Graston. So we have a couple different Graston tools here just to kind of show for reference. This is a deep tissue technique that we use to break up scar tissue and adhesions within the joints themselves or within the muscles surrounding those tissues. Usually due to injury, post-surgical, we'll start to get some scar tissue built up in those areas. This needs to be broken up in order to allow full, better function and motion within those joints. Next one that we've got here is the compression boots. We have these here in our office as part of our rapid recovery center. They're really good after a long run or a workout or a game, just to help to decrease the amount of swelling, inflammation in the lower legs, help flush that stuff out, help with some knee issues as well. Last one we've got here is our deep tissue cold laser. So the cold laser, the deep tissue laser, works at kind of the cellular level to help to induce healing more or less. So we're basically affecting at that same area that we kind of talked about with the Graston tools, looking at some scar tissue, any kind of injuries that may occur, or just kind of overuse to help to decrease inflammation and swelling within those joints. Make sure to head over to wellnesslab.tv to download 3 foam rolling exercises, and we'll see you next week.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.